where are you talking about? Because we have different regions, different states, different cities, towns, and counties. So some counties may have such a low level of infection that schools can open in a way that's exactly like normal. Others may be in a situation where it isn't really bad where you want to close the school, but you might want to make some modifications, alterations of scheduling, things like morning, afternoon, one day or another day. So it's up to the local officials to evaluate where you are in the particular region, what the recommendations that we really very carefully put out about the guidance of opening schools. So you don't want to make one size fits all for the United States. You want to tailor it to the degree of viral dynamics in the particular location that you're talking about.
So looking forward, we're really only going to know when we get closer to that point so we can make those decisions. That's unfortunate, but obviously the reality. I'm about out of time, Dr. Hahn. I'll submit a question for the record for pool sampling. Thank you very much, and I yield back.
Thank you, Mr. Guthrie. It sounded like there was a monster that was going to envelop you at some point there. Next, we have Ms. Schakowsky from Illinois.
Thank you, Mr. Chairman, and I want to thank the witnesses. I have to disagree with you, Dr. Redfield. I think nowhere has the Trump administration's lack of leadership been more apparent than in our nation's nursing homes and long-term care facilities, where we've lost 50,000 residents and workers to COVID-19. So let's review some of the deadly failures. You delayed data collection on cases and deaths in nursing homes. You have not required states to conduct testing. You are not giving workers adequate PPE, and I agree with Congressman Doyle on that, to protect themselves. You are allowing facilities to literally kick residents out onto the street if there's a more profitable COVID patient to take their place. And since CMS Administrator Verma, who is responsible for the safety of our nursing home residents, has declined Chairman Pallone's invitation to speak, let me refer then to Dr. Redfield. The CDC website explains that your mission is to save lives by providing health information that protects our nation. So why didn't you require nursing homes to report any data on COVID-19 cases and deaths until May, 4 months after, you may remember, you told me about the first case in Illinois, January 30th, to report the case of human-to-human transfer. On June 4th, you testified before the House Appropriations Committee and apologized for CDC's inadequate, I quote, response to COVID-19 race and ethnicity data. Yet, the same day, CMS and CDC finally published COVID-19 data from nursing homes and failed to include race and ethnicity information. So when my office asked CMS about the exclusion, we were told to ask the CDC. So will you promise to include race and ethnicity information moving forward so that we can identify and address the racial disparities in nursing home COVID-19 cases?
Thank you, Congresswoman, for your question. First, I want to stress that since the early beginning of the pandemic, we've initially encouraged all nursing homes to report the cases through their health departments and through our National Healthcare Safety Network as of May 8th.
If I could just briefly interrupt on the word encourage. That, I think, is a problem, that there's been guidance, there's been encouragement, but what about mandating?
As I said, that as of May 8th now, it is a requirement that this be reported in through CDC, as CMS has made that required. And we are working to make sure this reporting is comprehensive to include ethnic and racial data, as well as I would put forth that we've worked hard to really accelerate training and retraining of infection control procedures in these nursing homes to try to mitigate the situation that unfortunately we did experience, as you pointed out, where the nursing home residents have taken a high burden of this initial outbreak. We will continue to work to get this reporting. This reporting is going to be forward-facing. CDC will forward the data to CMS. CMS will forward-face it so families can make decisions based on their understanding of how different nursing homes are performing. We have recommended that the nursing homes, as you mentioned, that they screen all residents, and we've recommended that they screen all workers in nursing homes on a weekly basis because we do believe this is an important area that we have to do more as a nation to protect infections.
And let me just say, this kind of suggesting and recommending has clearly not been enough, in my view. This is the view of many observers, families, workers, that there is a crisis in our nursing homes, that it persists, and that we insist that the government do more to help. And I yield back.
Thank you, Ms. Schakowsky. Mr. Olson of Texas.
Thank you, Chairman Pallone and leading Republican member Greg Walden, for having this very important hearing. Welcome to our 4 expert witnesses. Y'all have been on the front lines fighting the COVID-19 virus for about half a year now. We greatly appreciate all your efforts to make our country safer. And a special howdy to a former Rice Owl like myself, Commissioner Hahn. Go Owls. First of all of you know that Texas and Greater Houston have seen a spike in COVID-19 cases over the last week. Our state is at stage 3 of reopening, and the trend is not good. The Dr. Tony Fauci of Houston, of Texas, Dr. Peter Hotez, put out a tweet, and I quote what he said: "If this trajectory persists, Houston will be the worst affected city in the United States, maybe rival what we're seeing right now in Brazil," end quote. And that is damn scary. The spike in the Greater Houston region is due to one county, Harris County, which is the county, the 3rd largest county in America, and the county seat of Harris County in Houston, county seat of Houston, the 4th largest seat. Mr. Chairman, I'd like to have a graph entered for the record about the spikes in Houston, in Harris County, in Fort Bend County, Missouri County.
Without objection, so ordered.
Thank you. There's many factors why we're having a spike right now in Texas and in Houston. But what scares me the most is the increase in infections cases from people aged 20 to 39, the so-called youngsters. The last week, there are 1/3 of the new cases in my hometown of Sugar Land, in my home county of Fort Bend, in the Greater Houston region. This is because of their attitude. To sum up their attitude, my former boss Phil Graham said it best about these people, how they view this crisis. Bending the COVID-19 curve and ending the pandemic is like going to heaven. Everyone wants to go there, but fewer and fewer want to do the hard work to make it happen. I call this the bad attitude curve. And Dr. Fauci, if you were king for a day, how can we change this bad attitude curve and make these people address this issue for the threat it truly is?
Well, Congressman, you bring up a very good point. One of the very perplexing things about COVID-19, and I've, as some of you know, I've been dealing with viral outbreaks for the last 40 years. I've never seen a single virus that is one pathogen have a range from 20 to 40% of the people have no symptoms, to some get mild symptoms, to some get symptoms enough to put them at home for a few days. Some are in bed for weeks and have symptoms even after they recover. Others go to the hospital. Some require oxygen. Some require intensive care. Some get intubated and some die. So you have a situation that is very confusing to people because some people think it's trivial, it doesn't bother me, who cares? And that's one of the reasons why what we do have is a lack of appreciation, that you have a dual responsibility. You have a responsibility to yourself, because I think thinking that young people have no deleterious consequences is not true. We're seeing more and more complications in young people. But even though the majority, the overwhelming majority of them do well, what you can't forget is that if you get infected and spread the infection, even though you do not get sick, you are part of the process of the dynamics of an outbreak. And what you might be propagating inadvertently, perhaps innocently, is infecting someone who then infects someone who then is someone who's vulnerable. That could be your grandmother, your grandfather, your sick uncle, whom have you, who winds up dying. So it's a very difficult messaging when people say, I'm young, I'm healthy, who cares? You should care, not only for yourself, but for the impact that you might have on the dynamics of the outbreak.
The bad attitude syndrome